There is a change in the fashionable world. We were talking about BD and cigarettes about 40 years ago. Now we've got a herbal cigarette, herbal hookah, thinking that they are good. But the fact is they also have intoxicants, they also have the carcinogens, they all irritants. There has been increased risk of, the asthma in young children.
Is switching from smoking to vaping a step which is wiser or, a bigger sin?
One has to understand that vaping is a step to quitting smoking. But it doesn't mean that you keep vaping for years. It's maybe 3 months or 4 months under a medical supervision.
Do you think workplaces have a role to play in helping people quit?
I think so, very important. I think the workplace has to be smoke free, vape free. Patients would come to me, Doctor Saab, बहुत सारे लोग सिगरेट पीते हैं, उनको तो कुछ नहीं हुआ. मैं 2 सिगरेट पीता, मुझे हो गया. Because we don't know the threshold. See, even the one cigarette can spike the levels of the carcinogens and these toxic gases in your blood.
Does stress also directly impact lung health? Hello everyone, this is Khushboo Aggarwal, founder at Zyla Health, and once again, very warm welcome to the 14th episode of Conversations with Zyla. I have the pleasure to host today with us Dr. Manoj Goel,
Hello.
a leading pulmonologist with 40 years of experience and practicing at Principal Director and Head of Pulmonology, Critical Care and Sleep Medicine at Fortis Memorial Gurugram.
Thank you.
Thank you so much, sir, for joining us today. It is such a pleasure to learn from you.
Pleased to be here. Thank you.
So the topic today is Breathe Better, where we'll discuss everything about lung health, lung detox, and lung capacity. It is an important topic indeed, as pollution-triggered respiratory issues, asthma, and smoking-related disorders are becoming more and more prevalent, especially in the young adults. Early detection and prevention is more urgent than ever. And in honor of World Lung Cancer Day, which is celebrated or honored in this particular month, we're tackling this critical topic of Breathe Better. So with over 3 decades of experience, Dr. Goel is an expert in managing complex lung conditions and detecting smoking-related diseases early. His academic background is quite stellar. He has an MBBS and MD from King George's Medical College, Lucknow, followed by an advanced specialization in interventional pulmonology at the University of Lille, France. Sir has practiced at Fortis for the last 10 years, and before that, he's also practiced abroad. Thank you so much again, Dr. Goel, for being with us. So, to begin today's session, Dr. Goel, we always start with a rapid fire. That's a ritual, wherein we will cover certain aspects, more like myths, which our audience usually, is dealing with. And then, you can answer with a yes or a no. Yes?
Sure.
So, let's get started.
Absolutely.
So, thank you again, our wonderful audience, for joining us today. It is a real pleasure to host you. As we're going through this with Dr. Goel, if you have any questions, please feel free to write in the chat section, and we'll try to pick a few with Dr. Goel today. So, sir, we'll start with a rapid fire.
Sure.
Vaping is less harmful than smoking.
To a certain extent, yes, but not absolutely true. It may be as dangerous as smoking as it is if it is continued to be, consumed and used for a long period of time.
Great. Thank you, sir. Nicotine-free vapes are harmless.
Not really true again. They are less harmful than the cigarette smoking. But yes, continuing with smoking with nicotine products is again harmful.
Thank you, sir. Air purifiers can protect lungs from indoor smoke.
A little bit, yes, I agree with you. But if somebody continues to smoke, then not all the particles, dangerous particles they smoke can be, removed by the air purifiers. But yes, they would help.
You can reverse some lung damage by quitting early.
Absolutely. This is the most important intervention in quitting a smoking program. It helps. The lesser you smoke, the earlier you quit, the better it is.
Breathing exercises improve lung capacity.
Absolutely right. They do improve the lung capacity, the physical fitness, and your breathing exercises, tolerance, everything.
This one's for the party goers, sir. Occasional hookah is safe.
Not. Absolutely no. Hookah is perhaps more dangerous than any kind of a smoke, as a matter of fact.
Smoking 1 or 2 cigarettes isn't harmful.
It is not true at all. It is harmful. There is increased risk of cardiovascular events, lung cancers, COPD in smokers who consume 1 or 2 cigarettes.
Herbal cigarettes are safer than tobacco ones.
Absolutely no. They also have harmful carcinogens and the intoxicants.
Stress makes people more likely to smoke or vape?
It does happen, but other way around is also true. If you quit smoking, you feel more comfortable, more relaxed, and less stressed.
So the last one, you can detox your lungs with herbal teas.
They can soothe your throat. They have antioxidants, but they cannot detox the lungs.
Great, thank you so much, sir. So no type of smoking, vapes or hookahs or herbal cigarettes are safe, as sir is saying. But there is some
Absolutely.
hope, because quitting early can save your lungs from further damage and even prevent, more serious issues like cancer. Okay, so sir, we'll now deep dive basis these early learnings. We'll take some insights and go further. Our next segment, Dr. Goel, is to tackle the real fact about increase in lung troubles, especially in urban cities. So we wanted to understand, why do you think the city dwellers or people with corporate jobs are facing lung issues, are feeling more breathless day in and day out? What is really the reason?
Primarily because the lifestyle management, they don't find any time for the exercise. They are hooked on to their computers, not exercising. The respiratory muscles are becoming weak. The body muscles are becoming weak. The respiratory capacity is reducing. At the same time, there is a huge amount of indoor and outdoor pollution. We talk of air pollution outside, but there's a lot of cluttering inside the indoor environment also. And if you're indoors working on the computer all the time, then you're exposed to that indoor pollutants, even though you may not be smoking, and that can damage your lungs and can also have cardiovascular events.
Dr. Goyal, you touched upon a very important fact that while we see the AQI outside, we feel that in the office or inside the car we are safer. We don't see the dust as much. You're saying the indoor pollution is as harmful.
In fact, the AQI in the house may be much more. You've got the kitchen inside, you've got the closed environment, the old carpets, the dust is here and there, which is not cleaned properly. Your shoes, everything is inside. You sometimes you have got the pets, and then you are doing pujas with incense and agarbattis. So the indoor pollution may be much more as compared to the outdoor pollution, and this may be perennial, where you can have a variable outdoor pollution, but the indoor pollution is perennial, is the same level. So it is harmful.
So, Dr. Goyal, just touching upon this aspect, because very insightful for our audience, what are some of the ways to tackle the inside indoor pollution in an office, in a car, inside your home?
It's a good question, and I would suggest that we minimize the kitchen smoke for the most of the time. If possible, use more of a induction cooking appliances rather than the cooking gases or something else. They minimize the use of agarbattis, incense, the room freshener, car freshener, which is say are safe. In fact, they can be quite irritant. Even the mosquito repellents that we use can cause increase in air in the worsening the air quality inside. Similarly, you have to take care of the pets. I would not suggest to have your pets inside your house. If you love them, it's better to keep them out in your courtyards. And of course, proper cleaning, vacuum cleaning is more important than mopping. Avoid any old curtains. Your beddings have to be clean. They should be shown to the sun repeatedly. And again, lifestyle management. You must ventilate your house properly. You must have the exhaust in your kitchens. So all those things are important. Indoor is smoking. Again, must be prohibited at all. In fact, smoking is dangerous, injurious. But if you smoke indoors, then you are going to expose this smoke to your loved beings, the children, and they're going to be affected by the secondary smoke. So there are several precautions that we need to do, and I think we have a lot of scope to improve our air quality indoors.
Thank you, Dr. Goel. That was so insightful on how to manage indoor air pollution in the house. And what about offices, Dr. Goel?
Same thing. Offices again. I mean, they have to be made smoke-free, vape-free. That's very, very important. And again, proper air conditioning, cleaning of the air conditioners is important. Vacuum cleaning, avoiding any cooking material, cooking space, which should be absolutely maintained in a way that all the gases are exhausted out. So the same thing as we have to do, in our homes, we have to manage our offices as well.
Got it. And Dr. Goel, you touched upon secondhand smoke or, for your loved ones and with kids. So just deep diving into any gender-specific trends and age-specific trends you're seeing in terms of lung troubles. Like you've practiced for 40 years. So what were you seeing earlier to what you're seeing now?
I think there is a sea change in our lifestyle, urbanization. I give an example of the COVID infection. We had a COVID pandemic, but it was primarily localized in the urban areas. The villages were not as much affected. In our country also, we have found most of the deaths in the urban area. So there is something with the urban environment that we have. overcrowding, pollution, traffic, all those things are creating a problem. More stressful life is there. So this thing is there, and then we are not exercising. We are hardly doing anything for ourselves, and at the same time, we got the junk food available, eating. We're not having any proper, gorgeous Indian food, as I call, and missing out on them. And most of the time, we are popping up pizzas and other things. So all these things are affecting our lifestyle, decreasing our immunity, damaging our immune system, and making us more vulnerable. And coming to the second-hand smoke. The whatever you smoke is going to be inhaled by your dear ones, especially the kids, and there has been increased risk of the asthma in young children who go on to develop COPD even though they have not smoked. Increased risk of hypertension. We are quite often listening sudden cardiac arrest in the athletes, the young people. All this has started from the beginning because they've been exposed to these pollutants where the vessels have become stiff. There's more of atherosclerosis. Lifestyle measures I talk about, the pizzas and those things. So everything's a combination of multiple things of urbanization, advancement in our life, which is affecting our children, and as we are growing, is going to affect our health.
So I could see 4 decades of wisdom in that answer. Thank you so much. So just touching upon that, Dr. Goel, because what you said right now, sudden cardiac arrests, people dying of sudden heart disease is something which is really a matter of anxiety today in the young, right? And especially young men. Although, our topic today is on lung health, but you did mention everything's correlated. So we also see news where people say this person used to eat clean, used to exercise, everything was fine, but suddenly one day, lost to a cardiac arrest. So what, according to you, are the key reasons there?
Something may be related to his genetics, but I think the lifestyle again plays a very important role. It's not just where exercise is good enough, what we are eating, what is our stress level, that's also very important. We must check our lipids. Some of the lipids are really dangerous. If they're high, even though you may not having other risk factors, but those lipids can make you vulnerable for heart diseases and sudden cardiac events. So I think there are multiple factors which are involved in this, and I think urbanization is extremely important. We see these of more in the urban areas rather than the rural areas. We hardly get this kind of news from rural areas.
That's true.
So possibly our lifestyle management, how we are eating, what is our stress level, that is playing a very important role.
And so do you get patients in your clinic, OPD or IPD, who are complaining of certain breathing issues, and the symptoms could be confused between a lung health problem and a heart health problem?
It does happen. I mean, they would present with chest pain, breathing difficulties, sometimes cough and blood in the sputum. But we as a clinician are able to identify. But yes, if a patient or a common man has got this kind of problem, he should not ignore it. He should consult a doctor. Suppose it is cardiac patient comes to me and I feel it's a cardiac problem, I refer the patient to the cardiologist. Similarly, a patient who feels that I've got a cardiac problem goes to a cardiologist. If he feels a respiratory problem, he refer. But at least he should see a specialist. He should show himself to a particular doctor. And we also look into our family history also. So you've got a family history of asthma, possibly I'll be suffering more from asthma, but I've got a history of heart disease, hypertension, possibly I'll be suffering more from the heart disease and hypertension. So I think you must consult doctor and the doctor can rightly guide you to the right person.
Right. So unfortunately in India, all of us are dealing with family history of hypertension, cholesterol and diabetes. I don't think anyone is spared there. But thank you so much for highlighting that. Was what Dr. Goel is importantly saying is that if anyone faces any breathing difficulties or chest pain, it may be confusing whether it's a lung problem or a heart problem, but very, very important to go to emergency at the exact time and get your workup done by a doctor who may then prescribe an ECG or further tests. Thank you, Dr. Goel, for touching upon that important topic. So in terms of teenagers being impacted, especially because of these habits of smoking or partying where there's a lot of smoke or hookah, have you seen teenagers also walk up to you more often now?
Absolutely. I mean, they come with a lot of problems, as a matter of fact. Not only the respiratory problem, they got a lot of psychological issues. They would complain of vague chest pain, breathing difficulty, not able to sleep. And of course, physically they may be fine, but their stress levels are too high. And they indulge into these habits of vaping, thinking that vaping is safe, maybe smoking, alcohol. So it is harming them. It's going to harm them if this continues to be there. So a lot of stress has to be done in, educating them about relieving their stress levels and how these things like smoking and alcohol can affect their life.
Got it. And so you touched upon stress a few times. So does stress also directly impact lung health?
Absolutely, because ultimately, it does lead to some hormonal changes. Our adrenals are racing. It increases our heart rate, it increases our blood pressure, and ultimately the heart condition can also affect the lungs indirectly. Similarly, lung conditions can affect the heart indirectly. So those things are there, and I think we have to go for some kind of self-rehabilitation in terms of exercising, relaxation, timing time for ourselves, exploring ourselves, and try to see where we are going wrong and try to understand and rectify those issues.
Right. And Dr. Goel, there's an endemic of childhood obesity or teenage obesity in India and globally actually right now. Does that also impact lung health?
Absolutely, obesity is a disease. I mean, it's the mother of many diseases, as a matter of fact, and lung is one of them. And again, it comes back to the lifestyle management. You're eating pizzas and popcorns and have fats. No exercise. So obesity does affect it. If obesity is an inflammatory condition, and inflammation anywhere will cause inflammation in other systems. If you talk of asthma is inflammatory disease, COPD is inflammatory disease, and this may be perpetuated by the inflammation caused by the obesity itself. So obesity is something very, very important and has to be addressed.
Got it. Thank you so much, Dr. Goel, for touching upon those important topics of stress and obesity. We will segment into smoking as a topic itself because vapes, hookahs, and cigarettes have become very, very fashionable today. And unfortunately, it's a vicious circle of stress where there's stress and people think that this will help them de-stress, but it leads to more stress in the body and eventually it becomes a vicious circle. So, Dr. Goel, covering this topic, is switching from smoking to vaping a step which is wiser or, a bigger sin?
So the question is absolutely fine. The fact is that vaping is a way to quitting smoking, right? So what generally happens is they combine the two. They continue to smoke and they continue to vape. All right. So if you continue to smoke, even though it's a 1 or 2 cigarettes a day, and you continue to vape, then the effect of the vaping will not be there. It will be as dangerous as smoking is. So that is one. So if you want to, one has to understand that vaping is a step to quitting smoking. But it doesn't mean that you keep vaping for years. It's maybe 3 months or 4 months under a medical supervision, right? So vaping is not a substitute to smoking. It's a step to quit smoking. That is one has to understand. Or somebody feels, no, a school-going child feels that, smoking dead, I can start vaping. That is not acceptable. Ultimately, the vape may have lesser carcinogens, lesser chemicals, but it is as dangerous, maybe not as dangerous, but it is still dangerous as the smoking is.
So, sir, what really is in the vape clouds?
So the vape clouds is actually sort of aerosol, and it has got a lot of material. It has a propellant, which may be glycine. It has sometimes may have nicotine also. It may have other chemicals like metals, the arsenic, volatile organic chemicals, organic compounds, VOCs as we call them, the acrolein, what is called as formaldehyde. So
not sounding very good for the body.
Not sounding good for the body. The amount may be less, but yes, in a way to quit smoking, WHO recommends that you can use them, but only for a short period of time. And it is not to be mixed with the smoking.
So if a person is in an environment where others are smoking, they're not smoking, or in an environment where others are vaping, they're not vaping, what is the percentage damage compared to if one was smoking or vaping?
It's an excellent question. I tell you, who knows what is the threshold of the carcinogenic cigarette smoke? Do we know that? We don't know, right? So patients would come to me, Dr. साहब बहुत सारे लोग सिगरेट पीते हैं, उनको तो कुछ नहीं हुआ, मैं 2 सिगरेट पीता मुझे हो गया, because we don't know the threshold. See, even the one cigarette can spike the levels of the carcinogens and these toxic gases in your blood, which can cause mutation in a cell. Cancer occurs how? It occurs because there is a change in the DNA and there is abnormal multiplication of those abnormal cells, proliferation. So we don't know. So as a matter of fact, what we know is that even 1 to 2 cigarettes per day, vaping can be carcinogenic, can cause cardiovascular events. So it is not alibi that I can smoke only 1 or 2. Say, please, doctor, please allow me 1 or 2 cigarettes a day. At least I can live with that. Unfortunately, I can break your heart, but this is not acceptable.
Yes, in one of our earlier podcasts, we were sitting with a cardiologist and they were talking about alcohol is bad for health even even one, a peg of alcohol. So we were getting questions nonstop saying, can I have one glass of wine? Can I have one
No,
portion of,
absolutely no. In
yeah,
fact, what happens is this one becomes two, two becomes four, and four
right,
becomes six very quickly.
correct,
All right. So you're indulging in a habit from which you have to be absolutely away. Right. There are many other things to do in life. Why smoke? There are many things to do to burst your stress. Why smoke? I mean,
right,
one has
sir.
to ask yourself why you're doing it. Why you're jumping into a sea of ill health, a danger which can take your life away. And it can be a distressful experience as a matter. Those who suffer from COPD, those who have cardiac diseases, those who suffer from lung cancers, they have a miserable life.
And their loved ones.
Of course, I mean, they would be
I think the
affected.
caregivers suffer as much.
Yes, yes. So, I mean, you are harming not only yourself, your family, but the entire society as a matter of fact.
No, fair, fair. Thank you, Dr. Goel, for sharing that. And now coming to one common question we get from people: how about Friday night hookah? Is that also dangerous? Just every Friday, one hookah.
So, first of all, tell you that hookah, there is a myth that, as the vapors pass through the water, it is detoxified. It is not. Right? The carcinogens, all these intoxicants pass through the hookah. And the other thing is water gets contaminated with various microorganisms, fungal, and you inhale them also. So no hookah, no shisha, right? So there is a change now. There is a change in the fashionable world. We were talking about BD and cigarettes about 40 years ago. Now we've got a herbal cigarette, herbal BD, herbal hookah, shisha, thinking that they are good, right? They can make you feel good. But the fact is, they also have intoxicants. They also have the carcinogens. They all irritants, and they can cause all kinds of disease, which is smoke can
It's
do.
almost like saying I'm eating a healthy pizza.
Yes, absolutely, absolutely.
Got it. And switching gears to BD, which you mentioned, Dr. Goel, we still have people in the villages, what they call chillam or BD, which they smoke, and they feel that ये तो safe है, ये हम कर सकते हैं, ये तो हमारे बाप दादा करते आ रहे हैं. तो what is your view there?
Yes, you're right, because they think it's a natural product. ये तो भगवान का दिया हुआ है पत्ता, सब कुछ natural है. Tobacco भी भगवान का दिया हुआ है पत्ता है. पी लो नहीं. The problem with BD is that first of all it has no filter. It may have a lesser tobacco amount as compared to cigarette. But the problem it doesn't have filter. Secondly, the leaf of the BD is not very easily combustible. So what the person has to do is to take more frequent puffs, and he has to make a deep inhalation to keep that combustion going on. Otherwise, BD बुझ जाएगी, right? So that exposes more to the smoke, right? It goes deep down your lungs, right? It causes more destruction. In fact, BD smoking causes more lung destruction as compared to the cigarette smoke. Because cigarette smoke may remain in the airways, but the BD smoke, because of deep inhalation and frequent inhalation, goes deep down in the lungs and parenchyma, where it causes destruction of the lung. And they have much more miserable life, as a matter of fact.
Got it. And all these smoking type of addictions, Dr. Goel, they damage the oral cavity as well, and the neck area as well as the lungs?
So I can tell you it goes beyond your oral cavity, goes beyond your trachea, beyond your lungs, beyond your heart. It can go to your brain, it can go to your pancreas, the kidneys, in women, the uterus. It can affect the pregnancy, premature births, intrauterine deaths. All kinds of things can be caused by smoking.
Right.
So it's not limited to lung, it's a problem of the whole body because it gets absorbed in the blood, right? And then it circulates. So it's not only it causes the lung cancer or the oral cancer, it can cause pancreatic cancer, kidney cancer, brain stroke. It can cause anywhere. It can cause havoc anywhere.
Right. So, Dr. Goel, I think we have counseled our audience enough that smoking is a bad habit. And imagine 20% of people who were, say, earlier smoking wake up and say, okay, I heard Dr. Goel, from tomorrow I'm not going to smoke.
Let's hope so.
So, what tips do we give them to now de-stress?
De-stress, again, I think it's finding time for yourself, right? It's reducing your screen time, spending time with your family, with your children, looking to the future, right? Rather than looking into yourself and your stress level. And just analyze how your well-being is as compared to your peers. So again, spirituality, I'm a very spiritual person. I think the spirituality plays a very important role. And we have gone away from the spirituality. I'm not talking about any dharma or religion. I'm talking about spirituality, right? Whatever it is. So believe in God, have faith in God, have faith in yourself, have faith in your friends. And avoid the friends who indulge you into this kind of habits. That's very important. They could be very good friend, but my friend is smoking, he's not my friend. Because okay, यार तू मेरे लिए एक सिगरेट भी नहीं पी सकता क्या? या तू मेरे लिए एक पैग नहीं पी सकता? ये बहुत कॉमन चीज़ है.
बहुत.
आप खाना खाने जाते हो, पड़ जाते हो, तो मेरे लिए एक रोटी और नहीं ले सकता क्या? आई मीन रोटी तो मेरे पेट में जानी है, मुझे पता है मुझे क्या लेना है. सो वी शुड नो व्हाट इज़ माय रिक्वायरमेंट, व्हाट इज़ माय गोल. माय गोल इज़ टू प्रॉस्पर, माय गोल इज़ टू डू गुड थिंग्स, माय गोल इज़ टू allow my family, my children to have a better future. So that is what our goal is, and that sort of family atmosphere, meeting with good friends, positive thinking, healthy lifestyle. Think about healthy lifestyle. You should think that sugar, the salt, the smoke, they're all poisons. Right?
Sugar, salt, smoke,
Smoke,
alcohol.
all poison. Alcohol, they're all poisons. They're poisoning your body over a period of time, right? So that kind of aversion you have to develop. I'm not saying that absolutely poison. I'm popping in sugar doesn't mean but yes, there has to be a limitation.
So you think spirituality helps you stay away from sins?
I think so. I mean, that's very important, and I really believe in that. Honestly, I believe that.
Great, Dr. Goel. I'm very, very inspired by this conversation today. Although I take care a lot of my health, but I think I'm more inspired to do even more. Thank you, Dr. Goel. So now, Dr. Goel, segmenting into one important topic, which is smoking in women, which was not a trend at all. Like, apart from some villages where the older dadis used to do the chillam, it was not a trend with teenagers and young women or women of childbearing age, for example. So what catastrophe does that bring?
Yes, I'm very touched about this topic, as a matter of fact. I'm all for women, as a matter of fact, for their progress, their upbringing, their smartness, achievements. I'm highly impressed with them. When I see them in the Air Force, flying jets, I'm highly impressed. You are taking my interview, I'm highly impressed with you. But the fact is, when they smoke, just to see that we are comparable with men, they're much bigger than men. They have got much higher status than a man. What they can do, men can never do it. But possibly that is the peer pressure, they do it, right? Unfortunately, there is a physical difference between men and women that we have to understand. If the women smoke, the cumulative dose of the smoke is much more in women's lung because their lungs are smaller than the men's lung. Okay, and there have been found that several studies we have shown the risk of cardiovascular events, the asthma, COPD, and the lung cancers, they are much higher in women with the same cumulative dose in men. All right. So this is very dangerous. And not only they are going to be mothers, how their children are going to be. They continue to smoke, they're pregnant and they continue to smoke. Their child is going to be affected. They would be born with genetic abnormalities, genetic predisposition, more risky diseases like COPD, asthma, and heart diseases. I think they should absolutely forbid smoking. Women should never smoke. I think it's dangerous, it's criminal. They should not do it because they are going to be mothers. They're going to look after their children. And I tell you, they're exposed to many other chemicals. I mean, they're in the kitchen. They're exposed to the smoke. Most of the time, they are cleaning the houses. They're exposed to all those chemicals which are used for the chemicals. So indirectly, they're already overexposed to these toxic elements. And then on the top of the smoke, there is a problem. It's a big issue. And I'm really concerned about that.
Thank you, Dr. Goel. I think you're absolutely right that the haste for equality should not lead us to the sins and the bad habits which some of our male colleagues or men in our home may have. So great insights there for women, and especially of childbearing age, because you have to bear a human being and we owe it to them. So thank you, Dr. Goel, for that. So Dr. Goel, if there is a sign of lung damage given all of this, it could be because of smoking, vaping, hookah, or it could be because of the day-to-day pollutants we are exposed to. It could be genetically predisposition. How does it show up? What tests tell us that there is a lung damage, or what symptoms and followed by what tests? If you could cover that.
So they would come with cough, especially that would be more in the night, nocturnal cough, what we call it, can disturb their sleep. And they would have, breathing difficulty, especially climbing stairs on effort initially. Then they may have, some mucus phlegm coming out. There could be sometimes blood, and then chest pain and breathing difficulty. So those are the symptoms, and they are the early signs. So if your cough is persisting, you've got a nocturnal cough, you've got suddenly finding that I am not as comfortable climbing stairs, I should use the lift rather than climbing the stairs, then something is wrong. Okay, why it is happening? Your exercise tolerance is decreasing. So if these symptoms occur, it's better to consult at least a primary physician. And if your primary physician can take care of you, it's okay. But if your symptoms are persisting for say roughly say more than 8 weeks, better to consult a specialist, which may be a pulmonologist, maybe a cardiologist, who can examine you and tell you by doing various tests. Now, coming to the tests, sometimes the tests can detect the things about even though you may be asymptomatic. And unfortunately, if I tell you, majority of lung cancers are detected in stage 4 just on routine screening, and the patient is asymptomatic. Wow. Suddenly he goes for the chest X-ray, maybe doing a routine health checkup, you find there is a nodule there, and then it's spread out. Okay, so I think annual screening is very important after the age of 30 years, where you should do your vital checkups, that is sugar, the blood pressure, pulse, a respiratory examination, some basic tests, routine tests, ECG, chest X-ray. I mean, they can be done routinely, at least on a yearly basis. And if you got some new symptoms like this, then you should get yourself checked, where a CT scan can be done. If there is a substantial history of smoking for a long period of time, especially after the age of 50 years, then it's recommended that we should do a low dose CT scan in those individuals every year, as a matter of fact.
That's a full body low dose CT scan?
No, chest low dose CT scan. And then, of course, after the age of 40 years, one must do a echo at least, sometimes stress echo under the supervision of a cardiologist. So I think a regular checkup, looking into your symptoms, how you are dealing with, how you're behaving, how your lifestyle is going on. So based on that, and then with the help of the physicians, and you can sort out the problems and detect them early.
Got it. And Dr. Goel, there is a myth or a concern that we see that, X-rays or CT scans, they expose you to radiation that could be more harmful. So what is the risk-benefit balance there?
So we do not recommend X-ray in every patient, as a matter of fact. If there is a risk factor, somebody who has been a smoker for a long period of time, yes, the X-ray would be required, or somebody is coming with breathing difficulty, respiratory symptoms, X-ray. So we don't recommend X-ray or CT scans. CT scan we recommend especially patients with high risk who have got prolonged history of smoking, or somebody is coming with symptoms which is not explainable on the chest X-ray, then we do a CT scan. So I mean, we leave it to the physicians. But yes, they got additional exposure. But now the technology has improved significantly. Now, kind of CT scanners that we have, they've got a low dose CT scanners with exposure. Even pregnant women, if it is required, we can do a CT scan if required. It doesn't, with some precautions. It doesn't harm the baby, it doesn't harm the mother. I mean, the chances of harming them are very less, as a matter of fact. So we've got a very improved technology, and if your doctor feels that a CT scan has to be done, should be done.
So the benefits outweigh the risk
Absolutely.
under the guidance of a doctor.
Absolutely right.
Got it. Great. So Dr. Goel will now segment into, how do we manage the lung health issues if one is diagnosed with certain health issues. Could be asthma, COPD, or even, as you said, a nodule or a tumor of different kinds. So what are the usual strategies of management you have seen with the different types of patients?
So I mean, it's a very big question. From patient perspective point of view, he has to look into his risk factors and try to manage them. Again, lifestyle management is extremely important. That is the first step. And secondly, if you got a symptom, visit a doctor, and if the doctor advises you some medicine. For example, in asthma, majority of a small child, maybe 7 years, 8 years, goes to the doctor, and doctor feels that he's got asthma and advises inhaler. Suddenly, mother would become very upset. What inhaler? What are you prescribing, doctor? But if a doctor is prescribing, it is prescribing the interest of the patient. Inhalers are very safe, right? Very small dose. So those kind of preventive therapy, sometimes, preventive therapy is given, inhalers is given. So idea is always when you visit a doctor not only treats you, that the doctor makes sure that you do not suffer. And for that, if the doctor prescribes you some preventive therapy, maybe in the form of inhaler, maybe in form of small pill, which is safe and can be used for a long period of time, and it should be taken.
Got it.
So that's very important. But there is no substitute to your lifestyle management. Similarly, there is no substitute to what your doctor advises you. Both have to go hand in hand. That's very important.
Got it. And talking about pills, Dr. Goel, we also see people popping OTC supplements, way beyond what is usually recommended. So what have you seen as a trend? What do you recommend?
So the thing is, we have a problem. We try to solve this problem by doing another problematic thing. I mean, so that is what I can put it. As a matter of fact, there is no detoxifying diet. I'm very honest with you. What you have to do, a balanced diet, which includes the vegetables, the fruits, the legumes, the fish, dairy products, if you're not allergic to them, I'm talking. So that is the balanced diet that you have to take. You don't have to take anything extra. If you do your blood test, a doctor advises you to do a vitamin D or some vitamin deficiency, they should be corrected. That they help your immunity, they help boost your physical state. But otherwise, popping something in the name of herbal therapy, Unani therapy, immuno booster, I mean, that thing kind of thing really in scientific doesn't exist. They can make a big hole in your pockets, but they don't help you at all. The only thing is you have to manage your diet, you have to exercise, and avoid the toxins.
Right.
Toxics.
And Dr. Goel, this question may be a little off syllabus for our topic, which I'm still posing. A lot of people have lung health issues because of overweight, being overweight or being obese, and then they start consuming protein powders to reduce weight, and that becomes a very long cycle. This is beyond supplements, I'm saying. So, is that something that you recommend to your patients?
So we don't recommend it. For protein supplement would be recommended only when, doctor feels there is a protein deficiency. Protein supplement is not the management of obesity. Obesity management is cutting on your diet on fats, sugars, regular exercises, and it helps. Even simple yoga exercises, walk for 30 minutes, 40 minutes a day helps. The only thing it needs is discipline. So we sometimes get motivated, start this program very routinely, diligently for few weeks, and then we stop. And then we change our habits. We go back to alcohol, we go back to smoking, we go back to pizzas. Right?
So persistence is the key.
So I say it's a tapasya. अगर आपको मोटापे से बचना है तो आपको तपस्या करनी पड़ेगी. ये तपस्या है. Similarly, smoking, जो long smokers हैं, I mean, we have to accept the fact, reality. It's not easy. They do get cravings. बट उनको वो तपस्या करती रहनी पड़ेगी. मुझे आज ये मैंने इतने साल नहीं पिया है सिगरेट, मैं आज नहीं पीऊँगा. सडनली 2 साल बाद लगेगा कि आई वांट टू स्मोक. लेट्स ट्राई. What will you do? Please don't do it.
So what you're saying is beyond patches and gums and whatnot, your mental strength is what is the biggest
Absolutely important.
quitting strategy.
No, the quitting strategy again involves a multidisciplinary approach. It does involve the medical management. We have got the tablets available. Vernacularly, as I'm saying, is available. So sometimes, just not, practicing the quit smoking on your own by self-discipline and with the moral support may not be enough. Initial support time, maybe for 4 weeks time, you need some medical support in terms of some medical treatment, maybe some nicotine replacement therapy, maybe vernacular, and then behavioral therapy, psychological therapy. Those things are required. So if a doctor feels that, somebody who's been smoking for 20 years, I don't expect him to quit smoking just by behavioral therapy. He would need some medical support, right? So that is safe majority of time. Under supervision it is safe, it can be done, and it has a better results than, trying to quit smoking on yourself without medical support.
And Dr. Goel, you touched upon yoga, and we can also talk about breathing exercises as a sub-segment of that. For any lung health issues, it could be related to smoking or pollution or anything else. Does yoga, breathing regimen help?
Absolutely, they help and they improve your respiratory capacity, the muscle strength, and stress buster. They're all stress busters. But talking about yoga, it has to be done under supervision of a specialist. Initially, a yoga expert who can tell you what kind of yoga exercise you can do. Because sometimes at the age of 50 or 60, your muscles, your bones, they become stiff and they can cause more harm. So it has to be a gradual process. Coming to breathing exercises, simple breathing exercises, right? The pursed lip breathing or the diaphragmatic breathing or box breathing. I mean, they are all available. You can watch them on YouTube. They're very simple exercises. Sitting on, even in the office, you can do them. Similarly, when you're sitting in the office, you've been on a computer for 30 minutes, 40 minutes, just, take a few steps, get away, walk for about 2 minutes, come back, try to sit up as straight as possible. You can do some breathing exercise when you're doing your work. So those kind of continuous things can be done. So they really help. They improve your diaphragm, they improve your circulation, they bring down your respiratory rate, they bring down your blood pressure, pulse, everything. So they are very important, and the yoga and breathing exercise and other kind of exercises, they are very important. It has to be part of our life of every day.
Great, Dr. Goel. Thank you so much. And I believe that you practice these day to day. I could see the passion. Just going back, Dr. Goel, on the quitting strategies we were discussing, and I see we're getting some questions from our audience on this very aspect. First of all, can you start with an example of any patient who you thought would never quit, and you've seen their journey and what worked? Any example?
So again, I come to back to the word tapasya. It needs a lot of effort, as a matter of fact. I mean, as a person comes to me and tell him quit smoking, he knows he has to quit smoking. He wants to do it, but he's not able to do it. 20 years of smoking, he's got a bad lungs, and he See, no medicine is going to work until you quit smoking. So if I got an asthma, if I continue to smoke, no medicine is going to work.
Right.
About COPD, so first strategy is to quit smoking. That becomes a very important aspect. So we call it an intervention, quit smoking interventions. So initially we prescribe them some medicines. We give them close, watch. We give them a time frame, how to do it, and give them the nicotine replacement therapy. Some of the patients, sometimes nicotine therapy may be in the form of gums, it may be form of lozenges, it may form the patches. So what we generally do is start with patches. If the patches are not working, we can allow them a couple of gums in between when there is a lot of craving. So that is the medical part. Second part is the behavioral and psychosocial support. Social support comes from the family. The family is very important, and we have to, as a doctor, initiate a conversation. We have to tell them to look for your future, look for your children, especially your daughter, right, which is very important, and try to emotionally engage into the system, right, where they have to feel that they have a responsible life and they have to fulfill them. They know it, but then somebody has to keep motivating them. Counseling them. So that's why the family becomes very important. So when the craving occurs, that times the family comes into the picture. Wife can say, अच्छा लग रहा है, try to delay for 10 minutes more, try to delay 10 minutes more, अच्छा ठीक है, try to divert his attention. There are 4 Ds. So delay, divert the attention, offer him to drink some water, maybe some tea, and motivate him to do some yoga exercises, breathing exercises.
Delay, distract, drink, and
yeah,
the exercise bit. Yes.
Right. Go for regular walk. Ensure there is a yoga practice or exercise schedule in the life in that framework. And these patients have to be in proper conversation. They have to come back. So it's an effort which goes on. And initial 1 month is the most crucial point. If the patient is able to maintain that 1 month discipline, then the victory is there. He's going to win over. So
yes.
I
They
think
say every habit is built in 21 days.
Yes. So initial 1 month is important, and after that the things become easier.
Got it. And have you seen
But one thing is important: the patient has to be committed. He has to have that willingness to do it. I do see patients who are just, I should not use the word, they're stubborn. Docs up. किसी को नहीं होता, मेरे दादाजी तो 90 साल जिए थे, हुक्का सुबह शाम पीते थे. That kind of attitude, you can't change the attitude of the people. I mean, you can help them out. We as a doctor cannot dictate them. We can support them. They also know what is good and right. We can only support them. We are to try to be as supportive, but we cannot be very assertive.
Right. And you
ultimately it's your life. You have to look after it.
Right. And Dr. Goel, do you think workplaces have a role to play in helping people quit?
I think so. Very important. I think the workplace has to be smoke-free, vape-free. We must do regular yoga classes. If there is a lunch time, I think that all of them should assemble one area and do some breathing exercises. That helps. That reminds you that yes, your body is very important. It's not only your work, but your body is also very important. Your body is where you live, right? It's not in your house. It's your body that lives. You have to look after your body more than your house and anybody else. So positive culture, some incentives, right? Somebody who is living is smoking, you can offer him some incentive. I won't monetary incentive, but there can be some other, maybe some small gift or something, and celebrate his victory. I smoke, right? Then we can, suppose I leave smoking after 1 month or 2 months, then there could be a celebration. Oh, he left smoking. That's an achievement. That motivates others also, right? Again, environmental control is important. We must try to make the indoor quality as good as possible, proper cleaning of the place, respect for each other, mutual respect. So those things, it's a grooming of the whole atmosphere, whole persona, which is important.
Right. So support from every part of life, basically,
yes.
plus your doctor, of course.
Yes. If you are being good to others, you feel good.
Right. And you're being good to your family, I think, if you take care of your body.
Yeah.
Great. Dr. Goel, we'll now segment into one of your favorite topics, which is lifestyle, diet, exercise, meditation, and important role. Very critical that we, cover this aspect. So now there is a lot of talk around anti-inflammatory foods, that if your lung has certain damage, you should focus on anti-inflammatory foods. I know you did mention throughout our conversation that it has to be the basic ingredients of a diet and keeping it homemade diet. But could you emphasize upon this fact?
I tell you, the body has its own healing power. The lung detoxifies itself. It has got a cilia, it has got a mucus lining, which produces the phlegm, clears the phlegm, right? It takes care of the infection inside automatically, majority. And we are inhaling a lot of bacteria, fungi, microbes inside the lungs. But lung is killing them. It's taking care of them itself. So we don't need anything extra to detoxify it. But we should avoid the thing which is causing toxicity in the lungs. That has to be our approach. So we continue to be using toxic things, We are exposing our lungs to the toxic things, and then we are thinking of anti-inflammatory, food, which of course doesn't exist, right? Your normal diet is itself anti-inflammatory. If you are taking legumes, you're having dairy milk products, pure food, nuts, so they themselves boost your immunity. And plus exercise. Exercise itself also boosts your immunity. Yoga boosts your immunity, right? So those things are more important than venturing into expensive products which do not have any scientific basis and consume them,
Right.
which
And
may in fact be more harmful.
correct, because we don't know what is there apart from the active ingredient.
Yes. So in the name of herbal, we sell everything, but that doesn't mean it is going to be safe for you.
Correct. So, Dr. Goel, you touched upon exercises. Are there specific lung healthy exercises?
Yes, I just touched upon them, like a pursed lip breathing, where to breathe in, then you have to breathe out by keeping your lips pursed. So breathe in for 2 seconds, breathe out for 4 seconds. Similarly, you can do diaphragmatic breathing exercises where you strengthen your diaphragm, because diaphragm is your main muscle of respiration. You put your hand on the abdomen and one hand on the chest. So when you're breathing in, you see that the hand of the tummy comes out of your chest, and when you're breathing out, then it goes inside and within the level, inside the level of your chest. So these kind of slow breathing exercises would help strengthen your diaphragm. Similarly, there's a box exercise where you have 4-4 rule, where you breathe in 4 times in jerks, then hold your breath for 4 seconds, and then again breathe out in 4 jerks. So this kind of exercises can be done. So there are many exercises. They're simple exercises. They work. You don't have to spend any money on them, right? You can do while you're in an office, while you're sitting, right? When you're trying to distract yourself from your work, from your computer, you can just do it.
Correct.
And that will make you more relaxed and maybe give more productivity in your work.
Right. And what is the role of meditation? You mentioned spirituality earlier, Dr. Goel, but meditation as a practice helps.
So, you have to choose. Meditation is it's not very easy to do it, but if you can practice, you do it. So, some sort of exercise which relaxes you, it's your choice. You can do aerobic exercise also. It doesn't mean if you're doing aerobic, it doesn't relax you. I have been a marathon runner and I know how good it is.
Oh, wow.
How you feel happy after doing a marathon race, how satisfied you feel. So whatever you feel comfortable, whatever you can do, you do it, but it has to be done regularly. That is very important.
Persistence is the key.
Persistence is important.
Right.
If you're happy with yoga, just do yoga. If you're happy with meditation, just do meditation. But you have to do something.
Right. And Dr. Goel, what about sleep and lung health?
So sleep is a gift of God to us. Right? We
Right.
spend 1/3 of life by sleeping. Sleep is rejuvenating. It builds our body. You remember a small child sleeps for 18 hours a day or 19 hours a day because he is building his body. Right? So it's a building time for our body. So sleep is extremely important. So it relaxes you, it builds your immunity again, builds your muscles, brings your strength back, and makes you ready for the day. So if you sleep well, your day is going to be good. But if you don't sleep well, your day is going to be bad. So sleep is extremely important. And that's why it's a gift of God. And we must relish it and cherish it.
Great, Dr. Goel. Thank you so much for sharing that. And I personally believe that if you don't sleep well, your next day, goes for a toss, and then again it becomes a vicious cycle.
Yeah.
And what about hydration? You did speak about using that as a distraction mechanism for people trying to quit, but overall, hydration and lung health.
So until there is a contraindication to fluid, for example, somebody got a heart problem or
Right.
renal problem or liver
Correct.
problem. So there are very limited number of patients. So if you don't have those diseases where your doctor has restricted your fluid, otherwise hydration is good. Okay. So hydration wise, again, it's just a water. You don't have to take anything extra. Good amount of water, the milk, all those things in whatever amount you want to take it. So I would say that take at least 2 to 3 liters of fluid every day. It's extremely important. It cleans your blood, it cleans your lungs. The mucus production becomes better. Your cilia, the lung cilia become better in working, functioning. So don't keep yourself dehydrated. Similarly, those people got a sore throat. They should keep sipping water. Right. Suppose you have got a job where you have to speak a lot every day. Because throat becomes sore. Keep sipping some of water. But it should be normal temperature water. It should not be cold. It should not be warm. Right. Just normal temperature water. Keep sipping it.
And Dr. Goel, you said a very important thing, just drink water. That's what you need for hydration. What also happens is that people start drinking different shakes, which either have sugar or they have salt, right? A shikanji will have salt and a milkshake will have sugar. So I think that also does more harm than good.
So everything you can indulge in those things, but it is in moderation. I don't
Right.
see that they are harmful. But every excess of anything which is beyond recommendation is harmful.
Right.
You can have your shikanjis, there is no problem. Right.
Thank you so much, Dr. Goel. I was so engrossed in our conversation that I have not even picked any questions from our audience. So we'll just pick a few. And thank you so much for being patient with us. So one question that we are getting from the audience is on what particular age is usually lung cancer found in, and even young people, can they have lung cancer?
So mostly, if you ask me, mostly after the age of 40 years, it is detected. But yes, young people, it can happen. But there are other kinds of cancers which occur in younger generation, like lymphomas, right, leukemias. They occur more in the younger age. But a majority of the cancers occur in the later age of life.
Got it. But if someone is smoking since a very young age, then they can get it in a
They
young
can get it, of course. Because
it.
then you're creating something,
Stimulus
a
for-
bomb, right? You're on a time bomb,
Right.
sitting on a time bomb.
Right. And I think we covered a lot about keeping our home safe. So there's a question on air purifiers, and are they actually effective?
So air purifiers, if you got a HEPA, they would be effective. But it's effective only for those people who are inside, right? So if a working person like me or you, it may not be helpful. But you got my Dadi ji who is all the time in house, there they can work. So it has to be matched according to room dimensions, and it has to be a HEPA filter. The important thing is the cleaning of those filters is very important, right? So if the filter becomes contaminated, it will cause more harm. So that maintenance part is important. But yes, it can improve your air quality, but it cannot remove all the toxins. It may not remove your volatile organic compounds. It may not remove all the toxins of the smoke. So it is not a substitute for your general maintenance of your house. But yes, they can be used
Got it,
in
Dr.
certain
Goel.
situations, but not for everyone.
Thank you so much. The next one we have is, if I can hold my breath for long, is that a good sign for lung capacity?
I think so. I mean, if you can hold your breath for a longer period of time, it is good. Our yoga is tend to do that. So it's a good sign if you can hold your breath. Yeah.
Okay, we'll cover a couple more, Dr. Goel. This one is on lung detox. That are there any tips at all beyond good diet and exercise that you mentioned for lung detox?
If you are able to do these two things, you are good enough. You don't have to beyond, and don't indulge in activities which can cause problems. Don't venture into the polluted areas. Watch the AQI values outside your house and within the house also. And if you find the AQI quality is high, then take precautionary measures. Use masks. Again, hand hygiene is very important. Vaccination according to the age is very important to prevent from infections. Like flu vaccination is recommended in all age groups majority of time. So pneumonia vaccination depending upon your doctor's advice. So, and if your doctor somehow, unfortunately, you have developed a disease, like I've got an asthma with no fault of mine, I'm born with that, then I have to be in proper medication for that as a preventive therapy, right? And consult my doctor even when I'm well. It's very important. We consult our doctors when we fall sick. But if you've got a chronic disease like hypertension, diabetes, hypertension, we must keep visiting our doctor as per his advice, maybe 2 months, maybe 6 months. Right, and get ourselves checked routinely.
And prevent the complications.
Prevent the complications.
And Dr. Goel, you mentioned around flu vaccine is for everyone. And this is a big awareness problem, I think, in our country.
Yes.
Could you emphasize which age group, how often?
So I can't comment about children because I'm not a pediatrician, so I don't want to comment. But after the age of 6 years, right, everybody should be taking the flu vaccination every year. But they're high-risk population. If there is a resource constraint, like suppose unfortunately the flu vaccine is not funded by the government, like the universal immunization program, so here we have to spend from our pocket. So whosoever can afford, then one should go for it. Even normal healthy person like me or you should be having
Once
the
a
flu
year.
vaccine once in a year, preferably do just before the winter, that is September. This is a time which is coming up.
Right,
One
right.
shot every year must be taken.
Yes, we just
Very
did a flu vaccination drive for our team.
Yes.
So we'll encourage
Yes.
our audience to also
Yes.
do it for
Yes.
their teams and their families.
Yes.
We'll just take the last one, Dr. Goel, and this is when I try to quit, I get constipation. Is that true?
So point is, there are many alibis that we gather around ourselves. So there's a lot of cluttering in our mind. If I quit smoking, this will happen. If I quit smoking, I won't be able to go to sleep or get up in time, or may not be able to, clear my bowel. These may just be temporary things. If you're not able to clear, there are medicines available. You can use them, which are much more better as compared to smoking than continue the smoking. And it's a very important aspect. This is one thing they always say. कि डॉक्टर साहब मैं फ्रेश नहीं हो सकता अगर मैंने सिगरेट नहीं पी. I think we have to tell them, even without cigarette, you can become fresh. In fact, cigarette smoking can cause more constipation. It can affect your GI tract also, right? So there are many diseases which can be caused by smoking. So in the GI tract. So I think we should not succumb to that kind of emotional blackmail from our family members. So, I mean, whosoever is smoking. And we must be very clear in our thought process that smoking is absolutely no.
Or consult your doctor if you face that.
Yes.
Great.
So,
We have many more questions, but we'll request our team to keep addressing those. But thank you so much, Dr. Goel, for being with us today. I learned a lot beyond medicine, around spirituality, good life, and it's so good to know that you practice all this in your life, and you run marathons, and you practice meditation and breathing. It is wonderful to learn from a person who's walking the talk.
Thank you so much.
Thank you so much for being with us. It was a real pleasure learning from you and hosting you today.
Thank you.
To our wonderful audience, signing off. Thank you again for being with us. This was Dr. Manoj Goel and Khushboo Aggarwal. We'll see you again on the 15th episode of Conversations with Zyla. Till then, Shabba Khair. Good night.
Thank you.